When you educate a woman, you're also improving her health. Gandhiji said, educate a man, you educate an individual. When you educate a woman, you educate an entire family. So, what are the outcomes of those of a family? Most critically, those of her infants or the children. Since we know that only a Swasth Bharat can be a Sampann Bharat or a prosperous Bharat. Would it be fair to say that any kind of prosperity begins necessarily with good health of our women?
Amitabhji, namaste, and thank you for asking that question. I come from a family where women are working constantly and we are strong women, so thank you for that. I think the Swasth Bharat has to be a Sampann Bharat, because women have to really join the workforce, and in whichever aspect we look at it, they're strong, they're capable, and they're very committed to working. But it is kind of sad that in a country like ours, the DNA of an Indian woman or an Indian Nari is to put everybody else first before looking after her health. And I think that has really been one of the reasons why we're either talking about nutrition, we're talking about maternal mortality, simply because the focus hasn't been there, the communication hasn't been there, and that is something which is low-hanging fruit, and we need to step up on that. To do that, I think it has to be communicated that a pregnant mother has to be looked after in terms of nutrition, in terms of her checkups, and in terms of safe delivery. I know and I understand that health is in a way a state subject. The nation, the central government gives the policies, they give the budget, but it's up to the states to do it. Every state has to be mandated to do whatever they have to do for women's health and nutrition. I'm also so glad that in some of the states, the drive towards vaccination has been very front-led by the women, especially in the rural areas. And that is like a pleasant surprise for all of us who are working there and, working on the whole vaccination campaign. I also feel that we need to encourage, India really has the power of a large workforce whose skill properly can actually be economically self-sufficient and empowered. And to do that, I think we need to focus on skilling for women, whether it is in the healthcare space or whether it is just for them to self-sustain something which they can do. And I'll give you an example. In my dad's village, they did some amazing things with the women, so much so they had the strength and the courage to stop alcoholism. So I think empowerment of women is very important, and especially education of women. And health and nutrition has to become a natural coexistence for them. And I'm sure we can do that.